Margaret Chan, Director General for the World Health Organization, stated in a press conference on August 10th, globally the levels and patterns of H1N1 transmission now being seen differ significantly from what was observed during the pandemic. Out-of-season outbreaks are no longer being reported in either the northern or southern hemisphere. Influenza outbreaks include those primarily caused by the H1N1 virus, show an intensity similar to that seen during seasonal epidemics. Chan continued to state that though the epidemic has been declared as over, this does not mean the H1N1 virus will not be seen again. Chan continued on to say, as we enter the post-pandemic period, this does not mean that the H1N1 virus has gone away. Based on experience with past pandemics, we expect the H1N1 virus to take on the behavior of a seasonal influenza virus and continue to circulate for some years to come. The first case of swine flu detected in the Turks and Caicos was in July 2009. By this time last year, August of 2009, 35 swine flu cases were detected in the TCI. After months of waiting, medical officials told News 4 in early January that the H1N1 virus vaccine would be arriving in the TCI at the end of the month. Now, a year later, News 4 recently interviewed Dr. Rufus Ewing, Director of Health and Human Services, about the distribution of this vaccine.
The distribution is going very well. We receive about 7,600 doses of the H1N1 vaccine early on in the year, and since February 20th, we have been immunizing the various target groups within the community. So far, we have gone about halfway through that number. We have administered about half of that number of doses available. So we are continuing our program in immunizing persons in the various target groups.
The WHO has declared that the swine flu has now been moved to a post-pandemic period. Giving recommendations to health officials about this new status, it is stated on the WHO's website. While the level of concern is now greatly diminished, a vigilance on the part of national health authorities remains important. Such vigilance is especially critical in the immediate post-pandemic period, when the behavior of the N1H1 virus as a seasonal virus cannot be reliably predicted. For example, it is likely that the virus will continue to disproportionately affect a younger age group, at least in the immediate post-pandemic period. Groups identified during the pandemic as a higher risk of severe or fatal illnesses will probably remain at heightened risk, though the number of such cases could diminish. In addition, a small proportion of people infected during the pandemic developed a severe form of primary viral pneumonia that is not commonly seen during seasonal epidemics and is especially difficult to treat. It is not known whether this pattern will continue during the post-pandemic period, further emphasizing the need for vigilance. Dr. Ewing told News 4 in the same interview that the TCI is following WHO guidelines and currently administering the H1N1 vaccine to all target groups, which include children, the elderly, healthcare workers, persons with various chronic diseases, and pregnant women.
But we have to be prepared for the worst, and the worst is the disease itself resurging and coming back on about a second wave. And if that ever happens, then we'll have more persons within the community immunized against it.